most famous physical therapist on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to show you the only safe way to crack your neck. Now, before you get excited out there, we're not going to try to upset any of the professional chiropractors or osteopaths or anything like that. We're going to stay in our lane, but we'll show you how we'll do that in just a minute. By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, you want to join us on our, well, go to our website first, bobandbrad.com, because we're always giving something away. Go to the giveaway section. You can also find the giveaway on Facebook. It'll be pinned to the top of the page. You want a short version of us, go to Instagram, Twitter, or TikTok. 60 seconds of us a day. If you want to see what we're giving away this week, this is a little sample. This is the Sleepovation mattress. And again, just a sample of it, but it shows the individual mattresses. It shows the little canals there that help airflow.
There you go.
Just most comfortable mattress we've ever slept on.
I love mine.
Yeah, I do too.
We're gonna.
Yeah, we got the pillow too. Yeah, we're giving. Actually, Brad, the winner gets. They're going to give away some pillows too.
Along with the mattress.
Yeah, and if you buy a mattress now with the discount below, you get 2 pillows automatically.
Oh.
Yeah, they're doing a whole different
It's a bonus.
thing. Yeah. So can we move this out of the way?
Yeah, we got work to do, Bob. I'll get it.
All right, thank you, sir. All right. So basically, what we're going to show you today is a gentle neck stretch that while you do it, you may get a crack or some cavitation. We highly recommend that you don't do some of the typical neck cracking that we see that people do themselves. They do this one and they do, I don't know, they do this one.
Yeah,
and they do those high velocity.
Put a little quick thrust in there, which they're putting themselves in harm's way.
Yeah, because you could hurt yourself. And in a very rare case, you can actually cause a stroke.
Sure.
We were just talking to our cameraman here who knew of an instance where this happened in our little town here, where a young girl, only 20 years old, actually got stroke-like symptoms from having her neck manipulated. Right. So, it is something, it's a real thing. It's very, very rare, but it's something that you have to be concerned about. Actually, if you take a look at this real quick, Mike, if you want to focus on that, you can
look at the anatomy of the neck.
You can see the arteries there, how they intertwine in through the cervical spine. So you can see if you twist, you can see how there's stress on that artery. So if you have some issues with the artery already, you could certainly throw a stroke there.
Sure.
Throw a clot. So, all right, let's get to the stretch, Brad.
All right.
What are you holding up? Why are you waiting?
Well, I got my pen. I got to put my pen away.
All right. So basically, the trapezius is a big muscle that attaches up into the neck. We're going to try to help kind of stretch, release that. So let's say you're feeling tight on this side. You're going to take your arm and put it behind your back, in the small of your back.
So like here?
Thank you, Brad. Yeah. And you're going to, with really good posture, I want you sitting up really nice and straight. You're going to take your fingertips and put them over onto the other side of the head, and you're going to pull over and stretch. And just by that very act, a lot of times you'll get a pop. Now, if you don't get the pop, don't worry about it. Don't be seeking it or searching for it each time, because it's not going to happen each time. But you can also do it on the other side. You can put your arm underneath like this. Good posture, fingertips, because I don't want you grabbing too hard, and this gentle stretch and pop at times.
And you only need 2 fingertips.
Right.
That's more than enough pressure.
Now, what Brad and I would like to do is show you actually an exercise that we think is even more effective than trying to crack your neck here.
Right, because in the last 20 years as a therapist, when someone comes in with neck pain, it's by far easier to treat than a low back problem. Typically, and this is one of the stretches that we have a lot of success.
A lot of luck with, and most people can do it.
Mm-hmm.
We're going to start off with, and you guys who watch this channel are probably so sick of this, you're probably vomiting in your mouth right now.
Well, they're doing it. I'm sure we get a lot of positive comments.
That's true. So we're going to start off with a chin tuck. That's always the first thing you're going to do. Good posture, and you're going to you tuck your chin in, You don't bring it down. You don't bring it up. You just back your face up like someone's throwing a pie at you, and do a couple warm ups in that regard.
Yep.
Then we're going to go ahead and have you work on extension. This is the one. This is the money maker. This is the best stretch most people with neck pain can do.
Sure.
Now the issue is if Brad starts doing it and it goes, oh, that kind of hurts.
Like right here. Oh, well, then it gets some assistance, and then that's the net. You wanna?
No, you go
Oh,
ahead.
yeah. So get a towel roll, roll it up. We got some tape on here just so it doesn't fall apart, and low on the neck, and hold it not real tight, but just snug. Lean into the back of the chair, relax. Do a little chin tuck first, and then just gently look back. And it's almost always my patients to say, boy, that feels good and I can go farther. When it starts to hurt, come forward. You can use a towel roll to help bring your neck forward. And you repeat that gently back till it starts to hurt. Don't go into the pain and then come forward. And typically with repetition, you go a little farther each time. And when you're done after 10 repetitions is what we say at one session is a max.
And you can do quite a few sessions a day.
Right.
You can do 5 to 8 sessions a day.
Right.
In fact, we recommend that you do so like every hour. You do this. This is going to make a lot more progress on your neck than just doing one exercise one time a day.
Right.
And you can also use like a stretch out strap, or you can use a towel in this regard too. Sometimes instead of pulling down, we actually pull up like this
Right.
and hit different parts of the neck and work on going backwards. Eventually, if able to, you can actually stop using the towel.
Right.
If after the neck pain starts to diminish, you can actually start just doing these without a towel. and
I'll
go
have
as far
some
as you can.
people, if they're flexible enough, use their hands
Oh, sure.
and use that for support. And, then you can use them. You don't have to, they're always there.
Right.
And that can work well.
So this is an exercise that doesn't really cause popping of the neck, but it can very much relieve any neck pain you're having. So,
Exactly.
all right, Brad, remember we can fix just about anything
Except for,
a broken heart, but we're working on
and
it.
we will continue to do so. We've been working on it for 9 years.
Yeah,
We made some progress.
we're doing really well, aren't we?